Welcome to The Birth Breakdown, a mini-sode series from Her Birth, Her Story. These short episodes are here to open conversations around pregnancy, birth, and postpartum. Things I believe every woman deserves to look into, to question, and just to feel empowered by. This isn't about telling you what to do or what's right and what's wrong. It's about giving you space to think, to learn, and to trust yourself a little bit more as you prepare for your birth. Let's break it down. Today's mini-sode is all about a question many moms wrestle with early on in pregnancy. Should I choose an OB or should I choose a midwife? There is no one-size-fits-all answer. Both providers can offer incredible care, and understanding the differences can just help you to make the best decision for you, your pregnancy, and your birth goals. A lot of times people think that if they choose a midwife, that automatically means home birth. And I just want to share that there are a lot of hospitals, especially the bigger ones, that have a OB team and then they have a midwife team. So it is just as important, even if you are having a hospital birth, that you know the differences between an OB and a midwife. So we're going to start with, what is an OB? An OB is a medical doctor who specializes in pregnancy, labor, birth, and surgical care. OBs are trained to manage both low risk and high risk pregnancies, and many are the providers who perform the C-sections and just other surgical interventions. Most OBs practice in hospital settings where there is an immediate access to operating rooms, anesthesiologists, and neonatal care if complications would arise. From a medical model perspective, the OB model tends to focus on risk management and medical monitoring. Pregnancy and birth are both often approached with careful oversight to identify and prevent future complications. So you might consider having an OB if these things are extremely important to you. OBs are highly trained in medical and surgical complications. They have immediate access to hospital technology and specialists, and they often are the best option for high-risk pregnancies. They are able to perform emergency procedures like C-sections if you were to need that. Some things that a lot of moms say are not their favorite about some OB care is that the appointments are very short. It often doesn't feel relational. Often there are higher rates of interventions or the cascade of interventions in some hospital settings, depending on your provider. And there's just less continuity of care. And you may not know which doctor will deliver your baby when you actually go into labor, which can be really scary for some moms. So now, what is a midwife? A midwife is a trained professional specializing in the physiologic pregnancy and birth, meaning that they focus on supporting the body's natural process of having a baby. There are different types of midwives, including certified nurse midwives, so CNMs, who often work in the hospitals or in birth centers. And then there's certified professional midwives, which is a CPM, who typically attend births in homes or at birth centers. They definitely take more of a holistic model perspective, looking at the physical, emotional, nutritional, and lifestyle aspects of pregnancy. Your appointments with the midwives are often longer and may include a lot deeper conversations, especially about nutrition and movement, mental health, and just birth preparation. You might consider going with a midwife if the following things are very important to you. They typically have a lot longer and more personal appointments. They focus on the natural physiological birth and often lower intervention rates for low-risk pregnancies. Continuity of care. You often know the person who is going to be delivering your baby. Some things to also consider is that most midwives only do care for the low-risk pregnancies. If complications do arise, then they will do a transfer to the hospital. Even if it doesn't happen often, it is still a possibility that obviously could happen. This is always a big one too, is insurance. A lot of times insurance plans do not cover home birth and do not cover certain midwives. So if insurance is important and you're wanting insurance to pay for a lot of it, then a hospital birth or a birthing center might be what is your best option. Some important questions that I think are crucial that you should ask when interviewing a provider, whether it's an OB or a midwife. These questions can reveal a lot about how they practice and their beliefs with moving forward in birth. So the first question is, what is your philosophy about birth? Do they view birth primarily as a medical event, a natural process, or is it a happy blend of both? Number 2, what are your rates for interventions like inductions, epidurals, and C-sections? Number 3, how do you support unmedicated labor if that is my goal? And I think that this question is one of the most important questions if you are going after an unmedicated labor, because your provider can make or break your experience. And I personally am talking from a personal standpoint, an experience that I had with my first in the hospital. I had a provider who was very fear-mongering. Even though she was a midwife, she was very fear-mongering and made me be very fearful. She would not have been a good midwife for me to have when it came to labor and birth, because my outcome might have been a lot different if she was there. The provider that I switched to, the midwife that I switched to, was phenomenal. She was so hands-off, super encouraging. She helped me to have the confidence to do it, and she encouraged me and didn't do anything that she didn't need to do at that time, which was big. Number 4, what happens if my pregnancy becomes high risk? Number 5, who will actually attend my birth if I go into labor? Because just remember, like I had said earlier, if you have an OB or a midwife in the hospital, normally whoever's on call will deliver your baby, not the person that you have been seeing for all of your appointments. So if that's important to you, you definitely need to ask that question. What are your policies around movement, eating, and position changes during labor? 7, how do you handle situations where labor is progressing very slowly? 8, do you support birth plans or birth preferences? Those are all important questions to ask when interviewing your provider. And just remember, just because you interview a provider does not mean that's who you have to go with. You can interview as many providers as you want in many different settings, and then just go with the one that truly brings you peace, that truly supports you, and views birth however you want it to look. Choosing between an OB and a midwife isn't about which one is better. It's about which provider aligns with your pregnancy risk level, your birth preferences, and the kind of support that you desire and want most during one of the most important experiences of your life. Models bring valuable strengths to maternity care. The most important thing is just finding a provider who listens to you, respects your choices, and makes you feel supported and informed. One of the most important things that I think, because especially in today's age, OBs have such a bad rep, and then midwives have such a bad rep depending on what side of birth you're on. And this is the part that really upsets me and that I'm very passionate about. Just know that all OBs are not made the same and all midwives are not made the same. That is why education and these interview questions are crucial to figure out what is truly best for you. Because you could literally go to the hospital and see one OB who is strictly medical minded, where they're going to treat your labor and your birth as a medical procedure. You can go to the same hospital, get a different OB who, even though they have the medical expertise, they view birth a little bit different, to where they're more hands-off, to where they will only do the interventions if it's needed or if it is requested. Obviously, those are both OBs, but you are going to have two completely different experiences with those OBs. And it's the same with midwives. If you are interviewing a midwife for a home birth, they are probably going to have a different philosophy or go about to them than a midwife in a hospital. So you have to figure out what is going to work best for you. Not for your sister, not for your mother, not for Susie down the street. What is going to work best for you? Because this is your birth, your body, and your baby. That's all for today's birth breakdown. If this episode sparked curiosity, affirmed something you've been feeling, or gave you a new perspective, I'd love for you to share it with another mom or mom-to-be who might need it. Make sure you're following Her Birth, Her Story, and if you feel called, leaving a review is one of the best ways to support this space, and it helps these conversations reach more women. Until next time, remember, this is your body, your baby, and your story. We are reclaiming birth one story at a time.